Hi, this is Dr. Stone. I wanted to take you through a brief description of our laboratory testing. I talk a lot about the full system analysis and how you can actually get to the what is wrong with me conclusion, and from there you can create a plan to get out of the problem. So this is actually me, so there's no problem with patient identity here. A few years ago, started getting sinus problems. It caused complete blockage, so I couldn't sleep at night. And it seemed to, no matter what I did, it was getting worse, kind of culminating in like a 2-day severe sinus headache that had me just flat on my back, and then just ongoing congestion, fatigue. I felt miserable and lousy, and to be honest, I was desperate, and so I did a lot of diagnostics, and I asked for help. I sought some expertise outside of myself to get another objective look at what was going on. But here's the diagnostic panel. So this is the actual lab from Quest Diagnostics, and you can see this here is our out of range identifier, and then everything else is in range. And so as you scan, and this is what happens, one of the reasons I'm doing this little lesson is that so many people have been told by the doctors that all their labs are normal and everything looks fine, and try this medication, and are left kind of wondering, like, what the heck is wrong with me? So this is the what the heck is wrong with me diagnostic process. But if we look at the lab markers, these out of range markers are what is called a clinical range, meaning if your cholesterol goes over a certain, there's a clinical consequence there, heart attack, things like that. A lot of the clinical ranges are set to be identifiers of a named condition. So if you don't qualify for that named condition, they don't flag you. You aren't shown to be out of range. I'll show you in a minute, when we compare to what is an ideal range or an optimal range, we'll see the pattern emerge of what was going on in my system. So cholesterol panel, nothing is abnormal, and I'll go through these in detail a little bit as we go to the optimal ranges, but everything looks fine. I guess there's nothing wrong with me. Lots of numbers, but nothing really wrong with me. My vitamin D is perfect. Everything looks pretty good. And finally, we get a flagged range. And most doctors don't even do this test, so you'd never even get this flagged if you went to a normal, regular doctor. You'd never even get that test taken, so you wouldn't know that it would be out of range. And I'll explain what that means later, but it sure doesn't explain what's going on with my immune system and my sinuses and my exhaustion and inability to sleep. So we keep going down, and here we go. The CBC is what's called the complete blood count. So you're looking at your red blood cells, white blood cells, and the flagged range here that we see is a white cell called eosinophils, as you can read it right here. And these are the cells that respond to allergy and hypersensitivity reactions. So we know that there is something causing an allergy or hypersensitivity reaction. I'll show you how I went into the diagnosis of what that might have been. One of the indicators that it can be is a parasite. So I did, I was in misery and wanted to get out of it, so I did do the stool test and to see if there was any parasite contributing. Obviously, a parasite normally would not present as a sinus allergy kind of, sinus headache presentation. That's not a typical parasite, gut parasite, intestinal parasite presentation. So But I was just desperate and I wanted to check everything. We see one more flagged range here. That is the saturation of the iron. So this is your red blood cells and how it's taking up iron. And it shows that it's not taking it up very well, but I'm not anemic if you go back to the hemoglobin, hematocrit, MCV, and I'll explain what these all mean also. So here I am, kind of left with nothing on a standardized blood test. But let's take a look at what it looks when we compare to the optimal ranges. We'll get a better picture here. So now I'm going to take you through so you can see like what all these mean. So even if it's not flagged or marked, I want to give you an idea of what this all means. So TSH, you know, all these are blood markers, they're chemicals, they're hormones, there's proteins, there's enzymes, there's minerals and things like that in our blood that are measured and compared to a range. So like the TSH range in the clinical range is 0.4 to 4.5. The optimal range is 1.8 to 3.0. And this is, you know, if you're feeling really good, you're going to fall within this range. And you can see I fell within this range, and I wasn't feeling very good. My energy was terrible. But what that means is that the thyroid was not really the problem. So just to give you an example of this whole optimal range versus clinical range, the best known example is with diabetes. We know that a hemoglobin A1C, this is your measure of how up and down your blood sugar is. When you hit 6.5, you qualify for the diagnosis of diabetes. And then there's a protocol that, you know, follows: insulin drugs, insulin replacement. What was observed, though, is between 5.7 and 6.5, these people were not very healthy. So mainstream medicine actually created a name called Syndrome X, or metabolic syndrome. You can see here on mine, I'm almost qualifying for Syndrome X, or metabolic syndrome, and I'm pretty sure that's because of adrenal fatigue and low blood sugar. I'll show you how that looks. So there's a recognition that the clinical ranges do not necessarily mean that you're healthy. And if you get a number of subclinical but not optimal numbers, it starts to build up to feeling lousy. And so we can see those patterns when we compare to an optimal range. So let's go back to the top. So the TSH right here, if it goes low, we're looking at problems with insulin and cortisol. If it goes high, you're looking at usually elevations of noradrenaline. So we have a lot of stress factors and blood sugar factors that play a role here. Obviously, if the TSH goes up, usually the T4 is low, and that's why it's trying to get the thyroid to work. So on the low side with T4, noradrenaline again, and these are stress factors. And there are things that we can do about your levels of noradrenaline. If that goes up, usually there's going to be probably an immune, but it also could be a problem with like thyroid resistance, where most people know what insulin resistance is. It's where the body doesn't respond to that hormone. Well, that can happen with any hormone, and so that could indicate a level of thyroid resistance. The T3 uptake, which was my flagged range, this goes up because of stress factors. And there's different stress factors. One is called cyclic AMP. That's the chemical that we enjoy when we have a cup of coffee. It stimulates a chemical in our body called cyclic AMP. And what that chemical does is increase the effect of adrenaline adrenaline. So we kind of get an adrenaline surge. So this is really a cyclic AMP or caffeine adrenaline problem that we're looking at right here. If it goes down, there's usually a problem with testosterone or estrogen. We'll see that in women quite a bit, where their testosterone levels are going up. Also, estrogen will cause this number to go up too. So it's not an exact, here's exactly what you have to do, but we start to look at the patterns. And this is just your total thyroid output, so it's going to relate to those same factors. So stress, insulin, testosterone, estrogen are really the players with the thyroid. As we go down, now we have immunology ranges. Total white blood cell, obviously if that's up, you're in an acute infection. If it's down, it's something that's suppressing your immune system. Lyme disease, chronic heavy metals, or even chronic infections, more the subtle infections that stick with you and wear your immune system down over time. So we can kind of see if something is acute or chronic there. When something, so the rest of these are your different types of white blood cells: neutrophils, lymphocytes, monocytes, eosinophils, basophils. It's not important that you know the names, but what this means when it goes up is bacteria. When it goes low, it just means that your immune system is shifting towards some other demand. Lymphocytes, when it goes up, is more viral. It goes down, some other demand. Monocytes has to do with post-infection. There's a process called drainage, where your body needs to eliminate, most people are familiar with the lymphatic system, eliminate basically dead cells and pus out of your system. And that can, some chronic immune states will cause congestion in your elimination organs like kidneys and liver and gallbladder and things like that, intestines. Here's my big high number, and it was clinically high, the eosinophils, which respond to the allergy hypersensitivity reaction. So if you had a really bad, hay fever or something like that. So these give us two things. First, they give us direction of what we're looking for, and then they give us a target so that we can check back on how our program is working. Are we in fact being effective at moving this in the right direction? And sometimes we need to change gears and take another route, but we've got a lot of systems in place to problem solve and make sure that we're going to get you on the right track. Basophils are going to be more intestinal parasites when that goes up. C-reactive protein, normal when it's really low, just means that there's no inflammation in your system. And when it goes above 1, we're starting to see some systemic inflammation. When it goes above 3, we're getting into that clinical, they're going to flag you at that range. So it just tells us that there's inflammation in your system. We'll go down to that CBC again. When these numbers go high, that means there's dehydration. And your adrenals and kidneys are the main systems that function to keep your fluid status level. So while we would consider, are you drinking any water, or maybe somebody was just drinking sodas or something like that, if we see dehydration, we may if the person is drinking fluids, we're thinking more the adrenals and kidneys there. So we're getting pinpoint on what systems we need to focus on. When these go low, we're looking at some types of anemia, and that anemia could be problems with absorption, it could be problems with inflammation, but it tells us that you're anemic, and you can't, it doesn't mean just take iron. It may mean that we have to work with the immune system, so we go up to that immune block and see if something is going on there. Platelets, that's the blood clotters. When that goes low, usually that's going to be some sort of inflammatory autoimmune, and this just means a hypercoagulation, and you can see I'm just barely above, so I really didn't do anything about that. And then we're looking at iron, and then the iron binding capacity and the iron storage here. So you can see my overall iron stores are okay. These are also just other ways of indicating anemia. So this is like, okay, I could be trending towards an anemia if I don't get this saturation. But why would the iron not bind? It's because of the, go back up to the top, the adrenaline, cyclic AMP stress factors. And so it's just another way that the body adjusts to decrease the metabolism, to slow you down, because I'm not healthy at this point. Going down into cholesterol, triglycerides, and then the ratios here. So obviously if the cholesterol is high, you're looking at liver, thyroid, or insulin problems. If it's low, you're primarily looking at congestion of the liver. So you can see my cholesterol and triglycerides are a bit on the low side, and these are factors for creating hormones. Cholesterol makes a lot of your hormones, and triglycerides is really your stored or sustained energy. So I was exhausted, and part of it was because my liver was congested and I wasn't able to, I needed to keep eating constantly and burning sugar because I didn't have a good ability to create sustained or stored energy. The triglyceride HDL ratio is basically your level of insulin resistance. And you can see if it goes above 1.5, you're getting insulin resistance. I was low. That's reflecting back this whole triglyceride liver congestion thing. Glucose, of course, this is a fasting glucose. That's your blood sugar. When it goes high, we're looking at things like diabetes and insulin resistance. When it goes low, we're looking at hypoglycemia, which is generally related to adrenal fatigue of some sort. And then the hemoglobin A1C is your relative up and down of your blood sugar. And you can see, because my adrenals were pretty fatigued going through this process, I was actually bottoming out. I didn't have any high blood sugar. You can see it's actually really on the low side here. But I think I was probably at times going into hypoglycemia. Protein, albumin, and globulin, these are two fractions of protein. So this is total, and these two numbers equal this number at the top. It can indicate intake if you're low or high. Mostly, unless somebody's diet is really abnormal or inefficient, it's looking at digestion, absorption, and digestive inflammation. So when this number here, this is the one I look at primarily, is this globulin. When these numbers change, going into the low side, we're looking at digestive inflammation. So now we're hunting up. So I didn't have that. I still did the parasite test anyway. And when you're going high, so if that was 3.2 or something like that, now you're just talking about poor digestive capacity. So it's a completely different, direction that you're going. If it's high, you're looking at how do you get enzymes. You may want to replace them for a while and clean up the pancreas. You may want to look at the gallbladder and see if there's congestion there. And as we go down this list, we get pointers to tell us, where we need to go if there's digestive issues or digestive inflammation on this side. Then we have your minerals. Sodium going high is going to be hyperadrenal, so you're producing usually too much cortisol, too much adrenaline. Also could be dehydration. On the low side is going to be adrenal fatigue. With the potassium, just the opposite. Low potassium means adrenal, hyperadrenal, and high. So here's my indicator. And these don't usually go way out. So we're going to say that even though that's 1 point above, it's still pretty clear that that's an adrenal fatigue situation. Chloride is going to indicate high adrenals on this side, low on the other side, possibly acidosis if we're getting high chloride, and carbon dioxide. That's carbon dioxide right here. low carbon dioxide is going to indicate systemic inflammation and an effect on cellular energy. So in our cells, we have these little machines called mitochondria that make energy, and they kick out CO2 as one of their waste products, and that helps, to keep the blood pH normal. So when that goes low, we're concerned about our cellular mitochondria. Calcium. So all this, it could be diet. If you were having, junk food all the time that's preserved with sodium benzoate, we want to consider that. But most people who are in, some state of ill health, they're starting to really look at their diet, and they're really getting, serious about getting healthy. So I don't see that a lot, where somebody just needs to clean up their diet and they can be healthy again. Usually it's a rebuilding of the adrenal glands, cleaning up the immune system, figuring out what the deeper stressors are. So the calcium magnesium has to do with the thyroid and parathyroid. So when we go up this direction, we're looking at low thyroid or high parathyroid. Down this direction is going to be high thyroid, and there is hyperthyroidism too, of course, or low parathyroid function, and really same with phosphorus. So these are all parathyroid and thyroid. And again, if you were drinking 42 Coca-Colas that is loaded with phosphoric acid, that could affect you too. So, and we always do a diet history to make sure that we're looking at those factors. GFR is the glomerular filtration rate, and so going low just means that your kidneys are not filtering the way they need to. And then going high, there's not an indication for too high. I've never seen somebody filtering too high. The BUN, creatinine, are reflections of the kidney also. So you can see in here I have some kidney inflammation. It's just a little bit up, but it was something we wanted to pay attention to, and I actually did use a kidney product as I was getting out of this pattern that I was in. On the low side is going to be more kidney congestion. So that's the drainage issue with, getting pus and dead cells out of your system. So that's an immune situation. And the ratio just, kind of reflects back another look at how well the kidneys are working. The uric acid isn't inflammatory. It's another measure of an inflammation. It's kind of specific to the kidneys, but it can reflect vascular inflammation. And gout, is the condition that's most directly associated with that. And on the low side, it could indicate a metabolism process in the kidneys or liver. And then the last section here, these are the enzymes that are often looked at with heart attacks and things like that. So you have a heart attack, they measure your LDH, and it's through the roof. It's not 180, it's not 240, it's 1100. Because there's sudden death of those cells, they break open, they release all these enzymes. So really what we're looking at is this indicates bone, liver, gallbladder. Gallbladder is most specific to this GGT on the bottom. AST is heart, LDH is heart. There's some crossover with liver with the AST also. Bilirubin is kidneys. And so when it's high, we're noticing that it's an inflammatory process because the cells are dying faster than they normally would. There's a normal turnover rate of cells, and that's what those numbers should, reflect here. That's a healthy repair process. Here, we're getting pushed into inflammation in the liver. So that kind of goes back with the cholesterol, and we're getting, some indicators of liver here. And then LDH, again, when it goes high, we're looking at cardiac damage, vascular inflammation. When it goes low, it's actually a very good indicator for hypoglycemia. I mentioned that a couple times. Hypoglycemia is almost always caused by adrenal fatigue or exhaustion. And here on the, this one's most specific to gallbladder. So on the low side, gallbladder congestion, on the high side gallbladder inflammation. So it kind of points us to the organs, it points us what processes we need to handle. As I mentioned, I did do a GI ecology test to see what was living in me. It was all normal things. So what we did here was we tested hypersensitivity reactions, and my doctor located mold. And then we went forth with clearing mold out of our house, and he put me on a protocol that was really the most important process, which was cat's claw was the main thing that reset my immune system to bring me down, and it wasn't 2 days later. It took a while for that recovery. At the time I took this test, this was the highest eosinophil I'd ever seen. I think somebody recently surpassed it by a couple points. So it's a pretty significant hypersensitivity reaction or allergy reaction right there. So we treated the mold exposure in my body by treating the immune system, and sure enough, I started to, we treated the adrenals too. We put all the pieces together, and I started to get better week by week. So I could take the discomfort as long as I could see that I was going in the right direction. So what we get with this, the value, again, just kind of going back to the big picture, is we get pointers to what systems are stressed in your body and how they are stressed. What are the immune or the stress chemicals that are affecting your system? What are the immune imbalances, or if there's actual infections or something like that that needs to be cleared out of your system? So we get really the laundry list of things that need to change. So I needed to change some stress chemicals and rebuild the adrenals. I had to deal with the allergy hypersensitivity reaction, the systemic inflammation. I had to deal with the liver inflammation and congestion, and the hypoglycemia was really secondary to the adrenal fatigue. The parathyroid, the little change in calcium there, was really secondary to the histamine response, and then treat the kidney inflammation, and I was fixed. And I feel, probably healthier now than I ever have in my life. And I was on a good path prior to that, and I know exactly what happened in hindsight, and it was my own fault that I ended up in that situation, but it helped me to learn a very valuable lifestyle approach to dealing with the adrenals that I will cover in another video. So thank you for sticking with me and listening in. I hope it was of value to you. Bye-bye.